Hi everyone. Do you know what ECG and how to read ECG? So, normally the individual who is suffering with cardiac related diseases, so normally they will feel a severe pain in chest region. Okay. So, what is that pain, how this pain is causes and how we are going to treat this, okay, that we are going to discuss today. So, basically today we are going to discuss about two topics. One is anti-anginal drugs and anti-arrhythmic drugs. So, here before that we need to understand like what is the normal process that take place in cardiac muscle. Okay. Normally the contraction and relaxation of the heart is depending on the conduction of the electricity. Okay. So, here the SV node and AV node are self generating impulses are going to be transferred entire the heart and heart is going to be get contracted. So, here because of this stimuli, so the here cardiac muscles, in cardiac muscle there will be significant changes. I mean to say the opening of the various specific channels at different volts, okay, different millivolts is going to be open. Say for example, so here if it is minus 90 millivolts, so here normally in resting membrane potential, then when it enters minus 55 millivolts, so normally sudden sodium channels are going to be open and is going to be completely depolarized. The muscle is going the cell is going to be completely depolarized by opening of the sodium channel. So, when it reaches to the plus 30 millivolts, obviously these sodium channels are going to be shut down. That because of that we can see a slight repolarization. So, then is going to be exchanged with the calcium. Calcium channels are going to be open, sodium channels are going to be closed, and entry of the calcium is going to take place in phase 2 and 3. So, again at phase 4 the excretion of this sodium is going to be take place and entry of the potassium is going to be take place. So I mean to say, so these are the normal they maintain this rhythmicity for this. Okay. So, we will see like what is this angina pectoris. Okay. So, here what happens when sufficient normally the blood is going to be coronary artery is going to be take blood to the heart. So, here because some of the other reason, maybe emboli, maybe because of the stasis. Okay. So, because of the contraction of this coronary blood vessels, sufficient oxygenated blood is not reaching to the cardiac muscle. So, that leads here the demand is high and supply oxygen is going to be less. So, that creates a significant pain, okay, that we will call that angina. Okay. So, here normally angina is of three categories. One is stable angina and print metal or variant angina and unstable angina. Stable angina. So, normally what happens? So, here the individual is going to be perfectly alright, he is not going to be suffer any pain, but when he do some physical exercise, maybe running, maybe cycling, okay. So, in that case that individual is going to be feel pain. So, that is because, so his assume this is a artery of that individual. So, here there is a partially block, maybe atherosclerosis, maybe thrombosis. Okay. So, here a partial closing, a partial blocking of these arteries. So, when high blood is needed, so obviously this is going to be inhibit the supply of the oxygenated blood. So, then the individual is going to be feel pain, that is called as stable angina. Next, coming to the print metal or variant angina, it is said to be, so here the coronary vasospasm is going to be taken. Vasospasm in the sense, so here normal diameter of the blood vessel is going to be decreased because of the constriction of the blood vessel. So, because of the unknown reason, so here the constriction of the blood vessels is going to be take place. So, resulting, so this is the normal diameter. So, here it is constricted in a reduced way. Okay. That leads to the decreased oxygenated blood supply. So, because of that the individual is going to be feel so it is called as print metal or variant. So, normally if the sufficient oxygen is not reached to the brain obviously or a heart, okay, the individual is going to be suffer with. Okay. Next, it is called as unstable angina. So you can see, so here more than 50% of this blood vessel is going to be filled with some cholesterol or thrombi. So resulting very less oxygenated blood is going to be supplied to that particular tissue. So in this case, the individual cannot do its normal function. So he cannot walk half kilometer. So because here demand of the heart cannot be fulfilled by these blocked arteries. Okay, so since the individual is going to be feel pain, so without doing any work also he is going to be feel pain. So this is, he is said to be the very complicated one. The one has to be hospitalized. Okay, so how we can treat these individuals? So here we see the main problem is here the blocking of the arteries. Okay, so here and oxygen demand. So here we can do by dilating the blood vessels. If you dilate this, so we can increase the blood supply, or we can decrease the oxygen demand. Okay, either by dilation or by the decreasing oxygen demand we can treat these individuals. So here normally vasodilators we use. So now vasodilators are example nitrates, short acting nitrates, example glycerol trinitrate, isosorbide dinitrate. Long acting is isosorbide monohydrate and pentaethyl tetraene. Okay, so these drugs normally what it will do is it will dilate the blood vessels directly. Okay, so next calcium channel blockers. Calcium channel blockers utilized even in the vasodilation and for the depression of the cardiac muscle. So it can show both properties. Example verapamil, deldiazem, nifedipine and amlodipine. Next, or by suppressing the adrenergic receptors like beta blockers, propranolol, atenolol. So what these drugs are going to do is they are simply reduce the oxygen demand by decreasing the heart rate. So here the functionality of the heart is going to be depressed. So resulting of that normally heart needs the less oxygen. Okay, so that is why these drugs are going to be used. Okay, so coming to this arrhythmia. So here normally SA node and AB node is going to be there. So these are self-stimulatory, and apart from that Purkinje fibers, his fibers are going to be involved in the conduction of the electricity in the heart. Okay, so here, so first the stimulation starts in the SA node, then it reaches to the AB node, and first ventricular contraction is going to be take place, then followed by the arterial contraction is going to be take place, followed by the ventricular. Okay, so here in ECG basically what we do is we'll try to measure the conductivity of the electricity from the in the entire heart. Okay, how these impulses are generating and how it is transferring in the heart. So that is called as electrocardiogram. Electrocardiogram, we are measuring the electricity of this. Okay, so it basically has PQRST. Okay, so here P denotes the arterial depolarization and PR AV node conduction time. AV node conduction time. So SA node to AV node. Then QRS is conduction time in ventricles. So QRS the conduction time for ventricles, and T ventricular repolarization. So here normally what happens? So here these ECG will be taken on a graph paper which is consisting of 0.2 seconds. Okay, so 0.2 milliseconds. So we'll say like how much time it is taking to contract these articles and ventricles. Okay, if say for example any myocardial infarction is there. Okay, so any part of the tissue of the heart is damaged. So obviously the conduction is going to be deviate. So here we can find out at which region this deviation of this conductivity is taking place. So thereby the clinician can easily find out which part of the heart is affected. So that is said to be the ECG. Okay, so next anti-arrhythmic drugs. So here normally is going to be follow or rhythm. Heart is going to be get to follow this rhythm, lub dub, right? So here normally the heart is going to be beat 72 times per minute when you are when you are in the normal condition. So, it may be varies from 60 to 100. Okay. So, this is also said to be normal. If your heart rate is increases 100 per minute, so it is called as more than 100 to 150, it is called as simple tachycardia. If heart rate is increases to 150 to 250, is called as paroxysmal tachycardia. If it is in between 250 to 350 per beats per minute, then it is called as flatter. So, if it is above than 350 beats per minute, it is called as fibrillation. Likewise, if the heart rate is between 60 to 40 beats per minute, it is called as mild bradyarrhythmia. If it is 40 to 20, it is called as moderate bradyarrhythmia. So, if it is less than 20, it is called as serious bradyarrhythmia. So, here here the heart should be maintain a specific heart rate, so 60 to 100. So, if it is increases or decreases, it causes again the problem. Okay. So, here these arrhythmias can be controlled by decreasing the depolarization. This phase can be used by using the sodium channel blockers. Example, quinidine, which is isolated from the cinchonin, the bark. Okay. So, this agent has the ability to block the sodium channels. What happens when sodium channels are going to be blocked? Here the depolarization efficacy is going to be decreased. So, heart muscle cannot depolarize very fastly. So, resulting of that heart rate is going to be get decreased. So, that is how it is going to be work. Next, beta blockers, it will work by the same, is going to be block this adrenergic beta receptors, thereby the rhythmicity is going to be controlled. Next, blocking of the potassium channels, amlodipine. So, here the potassium channels also, so by blocking this we can attain this rhythmicity. Blocking of the calcium channels, contractility and rhythmicity can be controlled by using this calcium. This is how we can treat using angina and arrhythmia by using these drugs. Hope this video is useful. Thank you.